do you boo, but
That was the most terrifying thing I've ever heard Jeff
will
say.
the, yes it will.
No,
No, it won't,
it'll
hang on.
No,
It's
it'll
just,
Yep.
hi Cara, yes I can, thank you. Correct, yeah. Perfect. Awesome. I'll see them. I will, yep, that's cool, and Tony will just, I'm imagining, yeah, move from there and then move on to the main camera.
No, we've only had one.
We have one
Hey,
camera.
I'm all set to go, so,
Tony's doing my live and then we'll turn around and go onto the.
No worries. No, I can't, but the engineers
Do you
will.
need her to come?
Ideally.
Ideally.
The
that would be
engineers will
great.
be there. Okay. Sure.
Yeah. Cool. So what I'll do, yeah, that's cool. What I'll do is I'll just say they're coming in now, so we'll go back to you, Melissa, so that we can get set up so that Melissa then can pick up and do that. Perfect. That's cool.
Yep, that's all mate.
No,
That's all good.
yeah.
People want to
What
see
did you
things.
just say? the Minister was on Q&A this morning and gave no hint and no indication that this was going to be called. He's just walking in at the moment, so we'll get set up and hear from him shortly, Melissa.
Kia ora, good afternoon, everybody. Today we're confirming that there are 3 new cases of COVID-19 in the community and 1 at a managed isolation facility. The 3 cases detected in the community are a mother, father and daughter from the same South Auckland household in Papatoetoe. The mother works at LSG Sky Chefs and has been part of our regular testing cycle, although it was not her regular test that picked up her infection. The mother and daughter were tested initially when they felt symptomatic. They've now returned positive tests with relatively low CT values, which indicates that they are new and active infections. Their test results came through late last night. I was informed of them early this morning. The father was tested following their results, and his result came through late this morning. Whole genome sequencing is being rapidly carried out so that we can learn more about these infections and whether or not they are one of the more transmissible variants that we've seen overseas and have also been detected in other border cases here in New Zealand. It will also help us to identify whether there is a match with any of the cases that we have had coming into New Zealand. Today's 3 cases have 1 other household contact in their family unit. That person has been tested, and I understand that the result was negative. The Director General of Health is going to provide more information shortly, but before we get into that, I do want to provide reassurance that our system has swung into action. We are gathering all of the facts as quickly as we can, and the system that served us so well in the past is really gearing up to do so again. Our decisions from this point onwards will be informed by the science and the knowledge that we develop over the coming hours and days. We do have a plan for when things like this happened, and we will be making decisions based on that plan and based on the information that we gather. We expect to be able to provide more information later today. In these cases, we do act with an abundance of caution while the early information is being collected. And in that vein, the Prime Minister is returning to Wellington this afternoon, where she will be briefed and be actively involved in the decision-making process. As such, she will not be attending the big gay out in Auckland this afternoon. We'll provide an additional update once further information comes to hand. In the meantime, our message to the public and to the people of Auckland is to take the precautions that we all already know about. Follow social distancing guidelines. Please stay home if you are sick, particularly those who are intending to attend any of the events that are happening in Auckland today. Wash your hands regularly and scan in using the Tracer app. New Zealand's kept COVID-19 contained better than almost any other country, but as we have kept saying, there is no such thing as no risk whilst COVID-19 is out there. So we need to stay vigilant and be prepared, and we need to respond quickly, as we are doing now, when cases come to light. It's how we stamp out COVID-19 that matters in these sorts of circumstances. We know what's worked to date, and we'll continue to draw on those lessons as we respond to this most recent case. I'll now hand over to Dr. Bloomfiled.
Thank you, Minister. Kia ora koutou katoa. Just some further information building on what the Minister has said. We do know one of these cases, the mother, works at an airport laundry and catering facility, LSG Sky Chefs in Mangere. The case undergoes regular surveillance testing as part of their job, and the most recent negative surveillance swab was returned on the 18th of January. I should say, as the Minister has said, I want to reiterate, the reason we have found these cases is because these people did exactly the right thing. And for the mother, despite being on that surveillance program, when she and her daughter developed symptoms, they isolated and went and got a test. And that testing was done in a very safe way as well at the facility where it was done. The last time the mother was at work was on the 5th of February. Based on current timelines, we do not consider that she would have been at work when she was infectious. However, we are still working closely with the company to provide advice to people who work there. And of course, as you would expect, the company is working very cooperatively with us and is taking a number of actions to support staff there and also the investigation that is underway. I do want to acknowledge that while this case does not undertake work which has a connection, it does undertake work which has a connection to air travel, we have not identified yet the source of these cases, and we remain open-minded. That means we will continue to act with urgency to investigate all possible sources of transmission. As such, out of an abundance of caution, we are taking swift and proactive action around potential contacts of the daughter in this family, who is a student at Papatoetoe High School. Papatoetoe High School will be closed Monday and Tuesday. Staff, parents and caregivers, as well as students, are receiving information directly from the school today, and this includes instructions on what they should now do if they are considered to be close or casual contacts. For these people, I just ask that you please look out for that information and follow the instructions. Work is underway to provide a testing facility on site at the school. I do understand people will be concerned, especially around that school community. However, I do want to reassure them that we are taking this approach out of an abundance of caution. Public health officials and other agencies will be working closely with the school community over the coming days to provide support, answer questions and to provide pastoral care as required. The third positive case, the father is self-employed, and we are currently undertaking case interviews around his movements and contacts to identify anyone who may need to isolate and be tested. I know there will be strong interest in other locations of interest, and we have identified the following. In addition to Papatoetoe High School, where I have already indicated the early actions underway, the Pack and Save Manukau, for a short time on Friday, is classified as a potential exposure event. 2 of the cases had a very short visit of about 10 minutes on Friday. However, and again, in acting out of an abundance of caution, as we have done in similar recent cases, if you were at this location on Friday, last Friday, between 3:45 and 5 p.m, please stay home and isolate, be alert to any COVID-19 symptoms, and call Healthline to arrange a test, and you should stay isolated until you get the result of that test. Furthermore, last weekend, over Waitangi weekend, potentially around the same time the cases may have been developing symptoms but would have been unaware of this, 2 of the positive cases travelled to New Plymouth for a short holiday where they visited a number of tourist attractions. The dates are the 6th to 8th of February, and at this stage we are unsure whether the 2 people were infectious during this period, but in accordance with our other actions we are advising and acting with caution. There are or will be a number of locations of interest in and around New Plymouth, and these are being finalised and will be put on our website as soon as they are finalised. So thank you for your patience as we confirm detailed times, dates and location. This can take some time, and the list will be updated as more information becomes available. In the meantime, people in New Plymouth and Taranaki do not need to go and get tested unless they have symptoms, and please, we will publicise that information around the places and times of interest. And of course, anyone anywhere across the country, if they develop symptoms, should stay at home and call Healthline about arranging a test. In that vein, Healthline has increased its workforce and has people on duty ready in anticipation of an increase in volume, so please be patient if you do have a short wait, and you call back later if you can't get through immediately, but they will have extra staff on. And finally, to testing centres in Auckland, the hours for the regional community testing centres already there in Northcote, Balmoral, Henderson and Otara are being extended today, and the community testing centre in Wiri is also open today. As I've mentioned earlier, additional testing will be set up at Papatoetoe High School community from tomorrow, and more information will be shared with the school later today. Community testing station hours are available on the Auckland Regional Public Health website. can I reiterate, it's important for the right people to access testing. So please don't rush to a centre if you are well or if you weren't at one of the locations of interest. There is likely to be high demand, and it's important that those who need to be tested are the ones who we test first over the coming days. If you were at locations at the time of interest that are stated, you do need to get a test, and please isolate until you receive the results of that test. As always, if you are unwell with symptoms, do not go out, and particularly to some of those larger events that might be on in Auckland and indeed across the Motu today. Please take advice about getting tested from Healthline. Back to you, Minister.
Thank you, Dr. Bloomfield. Before I open up for questions, a couple of remaining key messages from me. New Zealand is currently at COVID-19 alert level 1. No further consideration of change to alert levels has been taken at this point. We will collect more information before we would make any such decision. We do anticipate being able to update further information later on this evening and whether any additional decisions have been taken or may be taken as a result of that further information. Jessica.
So we've been here a few times before, and often you've told us that there's low risk. This feels different this time. How concerned are you the Prime Minister's also flying back in?
I think what we've got there's a number of gaps in our knowledge around these cases. So one of the things that I will be looking for is more information on the likely source of the case, whether or not we can identify a likely theory for how any of these 3 cases contracted COVID-19 in the first place. That's still a piece of the puzzle that's missing at this point. We'd then also be looking for whether there is any evidence to suggest that COVID-19 could be out there in the community and circulating amongst others, or whether this is the start of what could potentially be a chain of transmission. So those are the pieces of information that we still need to get more clarity on before we can really make any further decisions.
Director General listed or said there will be more places in New Plymouth and others to come. What's the hold up with that? Is it because you're trying to gather the information, or are you trying to inform the business operators, which I know you were criticised for doing first last time?
It's just the ongoing gathering of information, and we've focused first on Auckland and then now going back because on the initial information we had from the cases, the mother and daughter, we didn't consider that the visit to New Plymouth and Taranaki had been within their infectious period. It's on further questioning, again, and particularly probing about the earliest time they may have experienced symptoms, that New Plymouth Taranaki visit may have come into the picture, and that's why we're now going and collecting more detailed information, and we will make that available as soon as we have it.
Audrey.
Can you tell us more about the mother's workplace, how many contacts she has there? Does she prepare airline food, or is she, washing up, collecting used plates from airline passengers, which presumably is a potential source of infection?
Her main duties are involved in the laundry aspect of Sky Chefs, so it provides both sort of laundry and food services for airlines. Her main role is in the laundry area, but also she is involved in some of the packing and preparation of meals. And obviously, and I don't have information about the number of people in that workplace or the people that she regularly works with, but once we have that information, of course, we can make that available.
It's been a long time since she was last tested. How frequently was she being tested?
She would have been on a 2-weekly cycle, and she had a negative test result from the 18th, and then she hasn't been in the workplace from the 5th, so she would have just been coming around for her next, on track for her next test, which is approximately fortnightly, but then she's been on leave since that period.
The airlines that she prepares food for being alerted at all?
We've certainly spoken with the Auckland Airport Authority, and the airlines are aware, Air New Zealand in particular.
Air New Zealand's certainly been informed.
There is quite a few big events on today, like we said, Big Hour, Valentine's Day, lots of people will be out and about. Have you given any more consideration to whether actually you should be telling some of these events to just sort of tie ho for now?
My advice to anyone who's organising an event in Auckland is to talk to regional public health, preferably not everybody, so that the organisers of the events should talk to public health about whether they need to do anything. At this point, though, we are still at alert level 1, and like I said, if anything changes in that, we will certainly be letting people know straight away.
Prime Minister flying back, does that mean that Cabinet is planning to meet somehow this afternoon to discuss whether there needs to be any alert level change?
No, like I said, that's a precautionary measure. It fits with our abundance of caution approach. There's still a lot of questions here. So having the Prime Minister in Wellington means that we can respond quickly and make decisions quickly in the event that we need to. But at this point, we don't know whether we will need to. So we're just making sure that we are prepared to respond quickly, whatever as information comes to hand.
There's no cabinet meeting tonight, no review of alert levels.
None has been scheduled yet, but that doesn't mean that we couldn't schedule one very quickly if we needed to.
Is the Prime Minister coming back and not attending the big gala because it's a big gathering?
No, basically, like I said, this is a precautionary measure. It means that if we need to respond quickly and make announcements quickly, we'll be in a position to do that.
Still go ahead?
I'll hand over to the Director General for feedback.
Yes, that question was certainly asked, and I've spoken to, just on my way down here with the organiser. They have actually a range of really good measures in place, and which they had planned anyway for this event, which I think are reassuring in terms of security, keeping a log of who is there and so on. They will be reinforcing those messages to those people participating. And the key one is either for that event or the America's Cup events or other large events or small events around both Auckland and around the country. If people are unwell, then they shouldn't be attending.
Jessica.
Is there a risk to people who were on the planes travelling, given that she was preparing things? Have you considered that as a possibility?
Well, I think the key thing here is, again, she hasn't been at work since the 5th of February, so actually well before her period of symptom onset. So there's no risk to her actually potentially passing on the virus through either laundry or through food. So that's reassuring.
So that avenue's closed off, you don't need to go back and look at all of that?
We will be going back, of course, and looking at her workplace. Given that it is essentially around the border, that is, of course, a strong lead in where she may have become infected, but we're not ruling out any other potential means either at the moment.
Hipkins and Monaco, are you going to have health people based out there to get the message out to ensure that people who are going there know that they need to be tested?
Well, just to comment that was a short period, and we've turned it into a longer period just to be sure, on Friday. So it's only people who were there Friday, not the people attending the store now who need to know.
So you're not putting anyone there to actually alert? I mean, there's no guarantee that people are going to be listening to this press conference that was called late. Like, are you going to do some sort of campaign in Auckland at these places to make sure people know to get tested?
Well, it's only the people who were there on Friday at the time the cases were there. Rather than people attending now. So we'll be pushing, of course, the information out through a range of channels about that time, and it's those people who need to not go out and about and to be tested.
We'll come over the far side.
In the past with similar cases, whether it's been nurses or people linked to MIQ, they've been living these kind of level 3, level 4 lives where they haven't seen many people. Do you have any indication yet about what their personal lives have been like? Have they been having house parties? Have they been seeing people? Anything that might be a red flag for a risk of a chain of transmission?
The comment I would make is that the only close contacts we've identified for any of the cases at the moment are household contacts, and the other events where there may have been exposure to other people are the ones we've talked about.
Yeah.
How diligently have these people been scanning QR codes, and is that adding a level of difficulty for you in terms of working out where they've been?
I'm not sure if we've got that information.
We don't have the information about use of the app. However, we have had no challenges so far in getting information about their movements. But as we find, even for people who do use the app, the information does evolve and we do update it. So again, we will update the general public as we find out other locations of interest.
On the front, yeah.
Presumably she works on international flights with the company?
The company actually provides services for a range of international airlines and also some domestic flights as well.
But she's had exposure to international flights, is that?
Not directly. So her work doesn't involve her going onto aircraft or directly having contact with aircrew or passengers. So she works in the workplace, and it's actually a couple of minutes drive from the airport itself. It's in that broader Mangere area. But certainly it is interacting with the border, you could say.
It's material from those flights that she's
Yes, or people who may be directly going onto those flights potentially to collect the food trays and these sorts of things.
Assessment of the risk to New Plymouth at the moment, or what your thinking is there?
Well, it's only really just come into the picture that they may have been pre-symptomatic, so not symptomatic per se, but we go back 48 hours from that very first onset of symptoms as when someone was potentially infectious. So that's why we've just started to look at their movements in the New Plymouth and Taranaki region over Waitangi weekend.
Audrey.
When was the genomic testing started and when do you expect it to be finished?
So the samples are on the analyzer at the moment and we're expecting the results this evening.
Any further questions?
Just with the school, because that's a sort of a different beast to deal with. Are you going to start the testing on site today to test everyone? Because if it's only at this stage planned to be closed for 2 more days, that you'll have to cycle through all of them reasonably quickly?
So some of them, they'll have specific instructions. Those who are close contacts may well be tested today through the regular testing centres, but we will be putting, the public health unit and DHBs will be putting a testing station on site at the school tomorrow. Again, the approach we are taking now in these situations, and you can see in the responses in Australia and a range of states, they're doing the same thing, is to go very wide with the testing, be less concerned about distinguishing between whether people are casual or casual plus contacts, and test people and ask them all to isolate till after they've had the result back. So that testing on site at the school will be from tomorrow.
Right, we'll take the last couple of questions. I'm aware that there will be more information later on today, probably at some point this evening, and we'll be able to answer more questions at that point. But we'll go from left to right.
Sorry if this has already been covered, but is there any concern or any information suggesting that the school and students may have been at an event together where other schools have come together, and if the daughter may have been taking the bus, like a school bus, and then that could be a big spider web out there? Any information around that?
No information at this point that I'm aware of. That's exactly what the investigation process will uncover if there is any such event.
What's your thinking on the threshold for another level change in a case like this? What would you need to see before you're suddenly convinced it might need to occur?
Like I've said, we don't have hard and fast thresholds here. You have to approach every individual situation based on the facts and the information as you find them. The key 2 things, I guess, that we're going to be looking for in the next little while is evidence of a source, where the virus may have been picked up and who may have been the first person to pick it up. And then secondly, whether there's any evidence of spread or that it might be out there amongst other people within the community. So those are key things that we'd be looking for in the next little while.
Can I just ask what the profession is of the father, and if that would have involved him perhaps going to people's houses, being face to face with them?
My understanding is he's a tradesperson, but more information would be released if necessary.
How many workmates has the woman got, and are they being tested?
I don't have the exact number, but we will be finding out that information. Her workmates like her will be on that regular surveillance program, testing program, so we will be working with the company to see when they were last tested. Our tendency in this situation is to, again, she hasn't been at work since the 5th, so she's unlikely because that's well outside her infectious period. I guess what we're also interested in is just to check that there's no other people in that workplace who might have evidence of any infection or a historic infection.
When was she actually tested? When was she and the daughter tested?
On Friday.
Before they went to the supermarket?
I couldn't say that. Actually, no, sorry, what's today? Sunday. So they were tested yesterday and the results came back through late last night.
We'll get the last 2 questions, one here and one there.
Sorry if this has already been covered, but do we know when the student was last at school?
Yes, my understanding is Wednesday last week.
If there's the possibility that she could have caught this from, do you have any thinking that there's a possibility she could have caught it from a colleague who is servicing those flights?
It's one of the avenues that we're not ruling out. And the other thing here is, of course, we've got to be really open-minded. There's a strong lead because she works in a border-related workplace. However, we don't want to close our minds off to other possibilities that, in fact, the infection has arisen somewhere in the community. The whole genome sequencing will be very helpful in this instance, and we're confident because the CT values of the mother and daughter are low, that suggests acute infection. There'll be quite a lot of viral material, so we're confident we will be able to get a result from that.
Are they in jet type now?
They're in the process of being moved there, the whole family.
Thank you, everybody. As soon as we know when we can provide the next update, we'll send out a notification of that. Thank you.